Artificial intelligence to predict innate ability for surgery. Each year in the United States, 250,000 patients die as a consequence of medical errors. This number represents a huge increment and equivalent to 155% from the previous report from the Institute of Medicine and accounting for 19,000 deaths. Medical errors include also surgical errors. A multicenter study in Michigan correlated the technical skills of surgeons with complications. The results showed that the surgeons with the highest level of technical skills were associated with the lowest complications and mortality rates, in addition to the shortest operation times. How can we reduce errors in surgery? A possible solution could be to improve the selection of surgeons. The traditional selection process of surgeons is still based on the evaluation of cognitive attributes like academic achievements and publications, in addition to subjective assessment of personality, attitude, and motivation based on interviews. However, it ignores the innate aptitude for surgery. Although ability for technical skills is not currently a component of the selection process for surgical training, there is a common belief among program directors to select those residents with the necessary level of innate ability for technical skills to become competent and safe surgeons. A survey with the surgical program directors in Canada found a group ranging from 5 to 15% of residents with difficulty reaching technical competence. We previously showed in a study with a virtual simulator for robotic surgery that there are 3 distinct groups in terms of innate aptitude for surgery. An elite group of about 6% of exceptionally gifted individuals, the vast majority, around 80%, with average technical skills, and another small group, around 12%, with subjects with poor level of technical skills. Unfortunately, in surgical training, there is no linear relationship between number of attempts and proficiency, and trainees are requested to reach proficiency consistently and not just once to exclude the by chance effect. In this picture, 3 distinct proficiency gain curves are depicted. The first, the green one, represented in the middle of the picture, represents a learner needing 9 trials to reach proficiency twice in a row. In the case of the red curve, the top, the learner needs 11 trials. In the last case, depicted by the blue curve at the bottom, the trainee is able to reach proficiency after 8 trials, as in the case of the green curve, but then they fail to confirm the benchmark. In this case, training becomes much longer and the learner needs up to 16 trials. We performed a study on artificial intelligence to predict proficiency during training robotic surgery using a virtual simulator. We enrolled a group of 176 medical students without previous experience in surgical simulation. They were trained until proficiency on 5 different exercises at increasing difficulty. We designed several machine learning models and compared the performances. The goal of the study was to find the minimum number of repetitions for each task to predict training time and number of attempts until proficiency. We framed the problems in terms of supervised learning, with the scores of the simulator as input features and time and number of attempts to reach proficiency as target variables. We split data as follows: 80% for training and validation sets, and the remaining 20% as test set. We initially trained individual neural network models on the training set. Their predictions on the validation set were used as input to train an ensemble model, making the final prediction on the test set. The ensemble model is called also meta-learner or blender because it mixes all initially trained models. The results show that ensemble neural network models outperform conventional ensemble machine learning models like random forests. Our models were able to reach an accuracy up to 96% for training time and 87% for the number of attempts. For instance, for the first task called Pegboard 2, we need only 5 trials to reach an accuracy of 87% for the training time and 84% for the number of attempts. For the second exercise called Ringworld 2, we need 3 trials to predict training time with an accuracy of 89% and number of attempts with an accuracy of 83%, and so on for the 3 remaining tasks called Matchboard 1, Ring and Rail 2, and Thread the Rings 2. This study has several applications. First, to streamline the design of a test at a virtual simulator for the selection of surgical residents. 2. To personalize surgical training based on innate aptitude for surgery. 3. To estimate in advance the costs in proficiency-based surgical training. In summary, a test with a virtual simulator can be used to assess technical skills for surgery to complement the selection of candidates. Artificial intelligence has the potential to predict the proficiency acquisition in robotic surgery and to identify the different patterns of trainees. Ensemble neural networks models achieve the highest accuracy among all developed models from 87 to 96 and from 79 to 87% depending on the task for training time and number of attempts respectively. This method can be adapted to other simulators. It may open a new chapter in surgical education.